today I would like to present about central nervous system drug amphetamine. We will go through pharmacokinetics and pharmacodynamics. Pharmacokinetics is basically about how body affect the drug. There is four main process or route of administration, which is absorption. Absorption is how the drug being absorbed into the bloodstream, distribution, transport of drug through the bloodstream to the targeted cell or molecules within the body. And then we got metabolism, which is it involved in enzymatic modification of drug, and excretion, how drug eliminates from body. This is only the basic of pharmacokinetics to have a better understanding. And for pharmacodynamics is about how drug affect the body. It involved in drug action, which is the receptor binding and dose response relationship, drug effect, which is the side effect, therapeutics index, and behavioral consequences. Okay, let us see about the amphetamine. What is amphetamine? Amphetamine is a psychomotor stimulant, which is a drug that acts on a central nervous system to increase the alertness, to elevate mood, and also produce a sense of well-being. Amphetamine also promote a neurotransmitter release. It acts by increasing the release and inhibiting the reuptake of monoamines. Monoamine is dopamine, norepinephrine, and serotonin. Amphetamine is contraindicated in glaucoma. Okay, for pharmacokinetic and pharmacodynamic of amphetamine, we will see pharmacokinetic first. Pharmacokinetic, as I explained just now, it has four steps, which is absorption, distribution, metabolism, and excretion. For absorption, for amphetamine is through oral administration. It is well absorbed in the gastrointestinal tract, and the bioavailability is around 70%. Distribution, it has three distribution, which is plasma protein binding. The plasma protein binding is a low percentage, as amphetamine bind to plasma protein, thus it will increase the drug that remains free in the circulation and allow for active effect. The volume of distribution also high. The amphetamine spread throughout the body tissue, which mean why it explain the volume of distribution high. And blood-brain barrier. Amphetamine is a highly lipophilic. It will help cross the blood-brain barrier efficiently. For the metabolism, it has two phases, which is first phase by liver enzyme cytochrome P450 and isoenzyme CYP2D6. And for the second phase is conjugation reaction, which are glucuronidation and also sulfation and excretion. Amphetamine is excreted through urine elimination. There are two types of pH, which is acidic urine and alkaline urine. For acidic urine, it eliminates amphetamine fast because amphetamine is on its ionized form. And for the alkaline urine, it eliminates slower amphetamine because amphetamine is on non-ionized form. The psychodynamic for amphetamine, which is the mechanism of action. I will explain the mechanism of action, which there are 4 points, which are amphetamine enter the neuron via transporter, disrupt the vesicular storage, it reverse transporter function and inhibit reuptake. Amphetamine enter the neuron via transporter, whereby amphetamine is taken up by dopamine, norepinephrine, and serotonin transporter into the presynaptic neuron. This will increase the monoamine neurotransmitter level, especially dopamine and norepinephrine, by binding to their protein transporter. Inside the neuron, amphetamine will interfere with the VMAT2 by inhibition, which is vesicular monoamine transporter 2. It will cause the neurotransmitter to be released from storage vesicle into the cytoplasm. It will reverse transporter function. The high cytoplasmic concentration of neurotransmitter force dopamine, norepinephrine, and serotonin to work in reverse, which it allow to pumping dopamine, norepinephrine, and serotonin into the synaptic cleft and enhance stimulation of postsynaptic receptor. Amphetamine also will inhibit reuptake of dopamine, serotonin, and norepinephrine, which it prevent reabsorption of neurotransmitter back into the presynaptic neuron, and it will increase the synaptic concentration. Thus the neurotransmitter level will increase, leads to increased alertness, mood elevation, and stimulant effect. And let us see the effect on neurotransmitter CNS. For the dopamine release, it will enhance focus, attention, and alertness. Norepinephrine, it will increase arousal and energy, increase heart rate and blood pressure. Serotonin release will elevate mood and suppress appetite. The clinical effect on amphetamine is effect on the neurotransmitter CNS. There are two effects, which are therapeutic effect and adverse effect. Therapeutic effect will enhance focus, decrease impulsivity, and reduce daytime sleepiness. Adverse effects, which are insomnia, anxiety, dependence, and addiction, and also neuropsychiatric effect, which is, for example, psychosis. The drug interaction. Monoamine oxidase inhibitor will block the breakdown of neurotransmitter, and this will cause the accumulation and will increase the risk of hypersensitivity. The alkalinizing agent, such as taking antacid, it will increase reabsorption and it reduces the amphetamine in excretion, leads to prolonged effect and high plasma level. Acidifying agent such as vitamin C will increase excretion to urine as a acidic pH. This will reduce therapeutic efficacy in ADHD or narcolepsy treatment. Clinical caution for drug interaction: avoid combining amphetamine with other stimulant unless it is prescribed by a physician. Overdose and misuse. Amphetamine also has some overdose and misuse, which are extreme agitation, and patient will be hallucination, hypertension, tachycardia, hypothermia, and also seizure. That's all. Thank you.